Hi guys, my name is Artie. I'm going to be taking you through my full LASIK procedure here at Swagel Wootton, beginning with my initial consultation and measurements, followed by my appointment with my optometrist to get me refracted to my optimal vision. And then those scans will be put into the wave-light LASIK machine where we'll be showing you the full surgery. And then followed by the post-op care for what it takes to maintain your eyes following this procedure. The first step is to take an array of scans, including a corneal topography which measures the surface of the cornea. This is done to determine whether the patient is a good candidate. Then the optometrist refracts the patient to determine their refractive error. A good candidate will have a thick, smooth cornea and vision that can be corrected with LASIK, such as astigmatism, hyperopia, or myopia. All those measurements will be put into the wave-light LASIK machine for surgery.
Tell me about your anxiety level right now.
Yeah, I'm a little nervous just because, the eyes are so sensitive and fragile. We depend on our eyes for everything, our eyesight for, everything we do in our lives. So I'm a little nervous, but I definitely trust the physicians we have here. I've seen the surgery being done, firsthand. So I'm definitely ready for it. The doctor puts in an anesthetic eye drop and keeps the eye open using a speculum. Here you can see the femto laser creating corneal flap at the epithelium. This is done by thousands of tiny gas bubbles that are created across the cornea, proceeding up through the epithelium to the corneal surface. This flap will be lifted and opened up to make reshaping the corneal stroma easier. Then the doctor gently lifts and opens up the epithelial flap to expose the stroma to the excimer laser. The excimer laser is not visible to the naked eye here, but you can hear the energy breaking the intermolecular bonds to reshape the cornea, eliminating the refractive errors. The doctor replaces the flap, rinses it out, and reseals the cornea. Finally, a steroid and antibiotic drop is administered.
Often, patients see clearly the day after LASIK. And they see a huge improvement in how well they see from the refractive surgery they had the day before. Some of the side effects of LASIK is that you might end up having a little red spot called subconjunctival hemorrhage on the surface of the eye. That's just superficial, that'll go away. Maybe a little bit of dryness and foreign body sensation. The biggest postoperative care is not to rub your eyes. Second to that is using eye drops about 4 times a day, the day after the procedure, and using artificial tears. The drops that you end up using would be steroid drops, prednisolone acetate, and an antibiotic to help prevent infection.
Thank you. Awesome.
That's so sad.